Let me read the question from the Media Express. Will Iran's decision to resume business activities spread the coronavirus further and cause more deaths among Iranians? Wouldn't that hurt the global fight against COVID-19? Ali-Reza, maybe you want to tackle this question.
If I understood the question correctly, is that the policy of Rouhani and Khamenei in putting people back to work, what kind of an impact it would have both inside Iran and outside? Definitely, this is going to be disastrous. We're already in a disastrous situation in the country, and getting people back to work when the situation does not allow that is like, it's really a crime. And it's going to multiply exponentially the impact of the coronavirus casualties. And it's going to impact not only the people of Iran, but elsewhere, because as we speak, the Iranian regime is still bringing so-called tourists and visitors into the country. People from Afghanistan, from other countries are brought in by buses. Just this week, there were a number of them who had come. They take him to Qom, to some religious centers in various cities of the country. And they want to show that, oh, everything is fine. We can still have the commute. We can still have the exchange. And all of that is actually hurting the citizens and the countries of other nations who would be infected in Iran, and then back when they travel, it's going to impact that as well. So this is not just a threat to the people of Iran. It's going to be a threat to everybody.
Thank you very much. Dr. Daneshkari, do you have anything to add to this, given that you're a professional yourself?
I do. As I was referring to the basically the stage planning for this pandemic, the countries are going through different stages. Based on the fact Iran has not reached to its peak, the peak of the curve, and therefore they still have to be in the position of medication. After the data shows, even after you have reached to medication and you want to come down, like the China or some other cities in states in the US are, you have to go to the phase of containment. So this madness that they have created in Iran has no public health logic, has no medical logic. It's the mullah's logic, which is unique to themselves. That the without reaching to the peak, they're releasing people or asking people to go work. I think is a crime against humanity. And as you know, during the earlier phase, they were responsible for spreading the virus to 17 other countries early, prematurely, before those countries could be prepared, for their pandemic. And this is going, because now, as you know, in China and some other parts of the world, the question is, what is the second wave of this virus is going to look like? Because we still haven't reached there, whether this virus will mutate and so forth. And this is absolutely a madness.
Thank you very much for that thorough response. We have a second question from the Media Express, which says, if US sanctions on the regime are really lifted and all Iranian money is released, could this really help Iran to fight COVID-19? Well, I can respond to this very briefly. Absolutely not. And I think case in point is, remember that during the Iran nuclear deal, after the JCPOA was signed, the Obama administration provided $150 billion to the Iranian regime, 1.7 billion in cash. But all of that money was not spent on the welfare and the well-being of the Iranian people. It ended up in Syria, Iraq, Lebanon, and elsewhere. Remember that under Khatami, while they increased the budget for the Ministry of Intelligence and the IRGC by 2/3, they cut the budget of the health ministry by 1/3, prompting the health minister to resign. So clearly, any money given to the regime will not end up helping the people of Iran.